Ira, and I'm currently doing my MSc Digital Marketing and Analytics from University of Kent, and I'm based in Canterbury.
Yeah,
Okay, that's great.
I think, Sarah, you should proceed with your part. Then I will go with the other parts.
All right. Thank you so much. I hope I'm pronouncing your name right, Nathaniel. Um, This interview would be based on different sections, for example, networking, leadership, and the work that you have done. And we would be assessing different activities. So, based on that, let's proceed with the first question, which is what are the three major qualities that you think a leader should possess?
So, first, leadership means the ability to use a simple but vital skills such as initiative, collaboration, and clear communication to create a meaningful change in people's life or the wider community. And I think a leader should possess a listening quality and an initiative and also collaboration. For example, a good leader listens carefully. So when a leader listens, he understands the community and also the people he's leading. As a result, he knows the challenge of the community and he will bring solution based on the challenge and knows what works to solve the problem. Second, a leader takes initiative. He doesn't wait for other people to act. He steps forward, took responsibility, and he builds solutions by bringing people together. The third quality skill I think a leader should have is that collaborations. I think a good leader knows that he can't do everything by himself. He needs to bring everyone to receive ideas from them and use that idea to work towards a common goal. And I believe these are the good quality a leader possesses. Yeah.
All right, great. So, like, I know that you have led some assessments and you have done some you guys got some grants from FIDO if I'm not wrong. So tell me that what was the most significant interpersonal challenge that you faced while leading your colleagues during that assessment, and how did you actually resolve that conflict? Or maybe the challenge that you had.
So, one of the challenge we faced during leading an assessment was that we were planning to provide a cash for nutrition assistance. It means that identifying a pregnant and lactating women to provide them with a cash that will support them during the drought period so that they will not engage in other kind of activity to bring money to feed their children. But one of the challenges we face that is that when we are conducting this activity, government stakeholders were not okay with it because they think that supporting a cash to some member of community will increase conflict between other community members. So what I did was that organized a meeting. So I bring people from different government sectors, for example, from women in child office first, and from health sector office, and additionally, I have also brought community leaders, particularly religious leaders, youth representatives, and women representatives. So I bring the idea that the need to provide these women cash that so that they only support their children. So during a drought period, they don't have to go to they don't involve in different activities I clearly communicated with the government officials. Finally, they approved it and helped that achieve the project, continue the project. Thank you.
All right, great. So, as a Chevening scholar, you will be in a room full of leaders, right? And it's evident that those leaders are also accomplished as you are. They have done something, that's why they are in that room. So how do you plan to lead from the middle when you aren't like the designated person in charge? Like in a room full of leaders, they already have some abilities, they have achieved something, they are also self-driven and have some traits of leadership. How do you think that you would be leading from in that scenario when you're not in charge, rather you're a part of that cohort?
Okay, okay. So, for example, one example I would like to mention to support my idea is that the challenge I have faced while implementing a project. This project is usually when I design a project, I target to reach 17% of people with disability. But usually I don't achieve this target. I usually achieve 9 to 10%. Uh, so uh, this challenge was not only my problem, but also a problem of different organizations. So our donor, Ethiopian Humanitarian Fund, organized a networking event to collaborate with different disability-led organizations. So in that workshop, I was representing my organization, and I had a chance to engage with Masasha Matuku. She is a program manager at uh, Ethiopian Center for Disability and Development. So I told her about my challenge, and she provided me with an advice that to include inclusion officer at a field level, so that I have to achieve my challenge. So I have to reach people with disability. So I bring that, and during a proposal development, me and my team were bringing ideas how we are going to solve in the new project we are designing this challenge. So I bring the idea that we should include an inclusion officer at a field level. But also, I have another idea. Why not create a partnership with that disability-led organizations, so that they can mainstream disability inclusion in our programs. Our team was hesitant at first because they didn't take the idea. So then what I did was that I read the manual of Ethiopian Humanitarian Fund guideline. In this, I found out that if we partner with organizations like women-led or people with disability, we will have an additional 10 mark. So this will help us secure the grant, and it will create also a strong partnership with other organizations. So when I bring them a strong evidence to partner, they finally accepted my idea. But only my team was not important to accept this. We have to influence our executive director. So what I did is that I organized my supporting evidence, and I have gone to him, and I showed him that this partnership is strategically important for us, and additionally it will also help us the challenge we have been facing, which is reaching people with disability. And through this, he also approved my idea. And finally, I communicated Masrasha, who is the program manager, and we wrote the proposal together, and we were able to secure a grant of $1 million to implement a project in one of the conflict affected region in Ethiopia. So from this to what I have learned is that to influence people, it is important uh, to bring evidence when you are full of leaders. This is how I do it, and Chevening is an important opportunity for me because it will engage me with leaders and network with them, learn with them, and also help me to give my experience, my learning experience for them. Thank you.
Great. All right. So you mentioned that you have built relationship with different NGOs, directors, and like different UN officers as well. So how do you maintain that professional relationship with those people once the project ends, once you are totally done with that project? Uh, do you have any example of that? Do you have any strategy that you maintain, that you use to maintain the connections with those people?
Okay, thank you. So when I was I was a general practitioner at a rural hospital. I was also an emergency department head. So during that time, a measles outbreak occurred, and our emergency unit was overwhelmed by cases. So
Mhm,
I immediately contacted the district health office and also WHO technical focus person, Mr. Amanu. So they organized a coordination meeting, inviting many national NGOs, international NGOs, and representative from Ministry of Health of Ethiopia. And
mhm,
in meeting, I had a chance to present about the number of cases we have been admitted in the hospital, and also the need to conduct a coordinated vaccination campaign so that we contain the outbreak earlier. And Dr. Amba Sutola, who is executive director of FIDO, a national NGO who was implementing another program in that area, also presented about the vaccination coverage in the district and the poor coordination between partners. So after the session, I had a chance to meet with him, and he asked me the need to engage hospital health workers with FIDO team to coordinate the vaccination campaign. That time I took the initiative and take the responsibility to coordinate FIDO's team, uh, coordinate the hospital health workers, and so after that I selected hospital 20 health 20 hospital health workers and organized them into 10 groups, and I organized a vaccination campaign in collaboration with FIDO's team. Because of that, we were able to reach 1230 children. uh, so within 2 months, we were able to contain the measles outbreak. From this, I have learned two things. One is that I was able to cultivate my coordination skill. The second thing is that I was able to create a meaningful professional relationship with Dr. Ambasu. After the project ended, I constantly engaged with them through email or through phone conversation. So after a few months, I found myself working at FIA Integrated Development Organization. This professional relationship I created when I was in a rural hospital, and the one I maintained helped me transition my career into a public health program coordinator. Now, currently, I engage with, yeah, different partners, donors, and after project in this, I usually engage with them to after implementing a project, we just don't leave. We always prepare an exit strategy, and we usually maintain a monthly or two times within 6 months a meeting to see whether our project has created an impact that we valued. This is how I maintain my professional relationship. Thank you.
great, that's good. Yeah, so one thing that you mentioned earlier, and that you in the content that we went through, that you wanted to connect with UK organizations that are working around or that maybe are adapting climate health strategies that will be helping you to use those strategies in your region, right? So
Yeah.
tell me any governmental organizations that you have identified and what's your plan to bridge the gap between the UK expertise and how you would be using in your region's context? A. B. Uh, when I mentioned that, let me know about the UK organizations. So, do you know any government projects that are happening in your country around the work that you are either currently doing or how you will be facilitating? So, these are two interconnected questions.
So
Did you
I'm
get it,
sorry.
or you want me to repeat it?
I think I want you to repeat the second part.
All right, second part. So the second part is, do you know any UK governments or any government project that are happening in your country in collaboration with UK government? And how do you think that your expertise would be benefiting those projects and your community?
Okay. Thank you. So, uh, so, uh, so the one of the organization I would like to connect with when I go to UK is the Oxford Management Group. So this group is led by Professor Ed Humphrey. So through a fund from the UK government and through the FCTO, they provide technical assistance to different regions by in developing policies related to disaster risk management. So these policies are mainly integrating disaster risk financing and also public health emergency management in low and middle income countries. And when I go to UK, I would like to engage with Professor Ed Humphrey particularly, and also in general the Oxford Management Group, to learn from their expertise what kind of challenge they face when they integrate this kind of policies in different countries, and also what kind of how policy integration methods they use, because I have to learn from them and influence policies in my country. For the second question, UK is currently implementing a building resilience program in Ethiopia. This policy actually is implemented by the Oxford Management Group, and it works with Ethiopian Disaster Risk Management Office, and they have already integrated a policy in disaster risk financing in public health emergency. But however, these policies are not being implemented in different regions. So when I return to Ethiopia, my plan is to build on this network and translate these researches and policy into practical actions, particularly in Borana region, Ethiopia, so that disaster risk funds are available. So these funds will help us when we anticipate crisis. We can mobilize it and fund the districts. So through this fund, districts will be able to strengthen the health system, strengthen the outbreak, increase nutrition, and also increase water access to community members, so that now we can prevent emergencies before they happen. So this is it. Thank you very much.
That's good. Uh, Razak, do you have questions?
Yeah. Are you done with your part? Yeah.
Yes.
Thank you so
Thank
much,
you.
Saira. Nakul, I have my very first question will be what is the reason for selecting University of Manchester as your first choice, and the Imperial College London as your third choice? And another connecting
I'm
question
sorry.
that uh, question,
I'm sorry. Give
uh,
me 1 minute, one
yeah,
second.
yeah, yeah,
I'm sorry.
yeah, yeah.
I'm back. I'm sorry.
Yeah, yeah.
It's
Should I
okay.
repeat?
Yes, that would be great.
Yeah, yeah. What is the reason for putting the University of Manchester as your first choice and Imperial College as your third choice? And also the another question which is related to that, why didn't you selected the Oxford University for MSc in Global Health, while you have already mentioned in your response that you will interact with the professor in Oxford. So that was a good thing that you must have selected the Oxford for the global health.
Okay, thank you very much. So I chose the University of Manchester for three main reasons. The first one is that the University of Manchester is world leading in public health research, particularly in the intersection between climate and health. So, and it is also closely linked to the World Health Organization Collaboration Center. So, through this chance, I would have a chance to engage in seminars and also research networks in which the World Health Organization led experts and public health leaders explain how research and guidelines are made, and also they are applied in diverse settings. So this experience will help me to know, not only to know what good policies and researches look like, but also how they are built, how they are tested, and also how they are implemented. So I will have I will have the knowledge and the skills to analyze global health frameworks and also UK standard in strengthening health system, in which I am going to apply to build climate resilient health system in Ethiopia. My second reason is that two modules which are specifically given at University of Manchester. The first is evidence-based practice. In this course is given by Professor Paula Whitaker, who is the head of this unit, and under her mentorship, I'm going to learn how to systematically review and critically appraise researches and programs. And so I can effectively judge whether a program is effective or not. So since global fund is shrinking in my country, we can't sustain all interventions or programs. So we have to analyze and choose cost-effective programs with greater impact. So learning the evidence-based practice course will help me analyze and design which programs to escalate and which program to reduce. And another specific course that would be given by University of Manchester is that the climate change and health adaptation course. So this course will help me learn how to interpret climate data and integrate it into health planning. So through this course, I will be able to understand to use meteorological data and early warning informations to design programs that are climate resilience. So these are the main reason why I chose University of Manchester. And the third reason is for personal one. I would have a chance to involve in a volunteering service. There is a group called Watrick Climate Action. In this group, we will go and build gardening and also community service that will help UK's climate strategy. And the reason the for the second question, why I choose London School of Economics for MSc Global Health Policy, I chose it because I in London Global School of Economics, I have a chance to learn about health policy and also economics. So courses given by London School of Economics are introduction to health politics and economy, and the other is that economy in low and middle income countries. And these courses will help me analyze health policies in Ethiopia, and what kind of the cost effective. I will try to understand the cost effectiveness of the programs being implemented in Ethiopia. So, like I mentioned before, I would have a chance which programs to reduce and which programs to escalate. The second reason is that beyond the courses in London School of Economics is more policy based, and I have a chance to engage in policy debates, and this will help me cultivate my leadership and negotiation skills. So when I return to Ethiopia, I aim to influence health policies. So to do that, I need the skills to bring discussions and to present my ideas confidently, and also influence college politicians and leaders who are resistant. That's why I chose London School of Economics.
Okay, keeping the shortage of time in mind, my last question will be, what if your government doesn't support your policy ideas? What will you do?
I'm sorry, I didn't
What
hear you.
if your government is not supporting you for achieving your career plan? What will you do?
My government.
If your government is not supporting you in achieving your career goals, what will
Okay,
you do?
that's a great question. So, one of the courses I'm going to take from University of Manchester is called Health Policy and Health System. So, in the first and second week, they invite guest speakers. These are real-world policymakers who have been reforming policies in different areas. For example, in tobacco use, in obesity, and also different public health programs. So I will have a chance to personally meet with them and learn from their experience and ask them a question about how they have been influencing to make reforms in different countries to implement policies. So this exposure will help me to know how to influence governments and different stakeholders to accept my policy. So I would have these skills to influence policy. This is what Chevening helped me to learn when I go to UK. Thank you.
Thank you. Now we have only 10 minutes. Over to you, Saira. Uh, what's your feedback on your part?
Okay, so I think some of the questions you answered great. Like what things that I liked about this interview and your knowledge is you have research done, you have courses name mentioned, you have professor names mentioned. These are good things. And I think you mentioned about you wanted to join the Oxford group for your thing, so that was good. But I think there is more need to make your responses structured in a way that I think it was those questions were random. Uh, what was like one of the questions that I asked in like the response, I was waiting for the response. I was waiting and waiting and waiting. But that came like at the very end. Right. So the to back that stance or back that response, the story was like so long. I kept waiting. Okay, when is my answer would be the question would be answered. So I think you can work on that. Maybe you can give a gist of it. For example, you have maybe you can repeat the give some stance, start with that, support it, and then conclude it. I think this is the ideal approach that I personally use, right? The starting, the backing, and then ending. So I think your responses need to be aligned with those things. For the networking one, I liked it that you said that like once the project is over, you guys come together to see the effectiveness of the campaigns and whatever you guys have done. So that is good. Um, at some point, I felt like you were just trying too hard to fix or fit whatever you have written in your statements. I mean, it's not necessary. So, based on my experience, like when my interview was taken place, they asked They didn't ask even a single questions from what I have written in the statement. My 80% of interview was around leadership only, not even networking, not even university choices, anything. My 80% of interview was around networking. They kept asking and asking and asking and asking till the point when they realized, okay, like the whole interview is roughly going around that. So let's just ask some of the questions. I think one thing that we missed and we should have done that was we should have asked you for a question that do you have any question for us? Right? This is very, very important. And I think when they asked me, and I did go prepared with the question that, okay, I have like these, I have this question for you. So for like the main person, the head person, he was sitting there and he literally had a brim smile on his face. Okay, the question that she has asked, we have to now answer it, right? And one person answered and second and then third, all three of those asked. So it's highly recommended, do your research around Chevening, around do have a question, don't ask the questions that are apparently available on the website. That will lower your marks in a way that they'll see, okay, he hasn't researched enough about the program. Or like people ask about finances, okay, will this be like fully covered, or will this be done and that. So the don't ask such kind of questions, are questions that are not available on their websites. So I think you are there. This is a good attempt. You can definitely do, but obviously practice makes things better. Yeah,
Yeah.
Razak.
Thank you, Saira. And overall interview was good. I have noted down some points like try to overcome your anxiety and don't be too much nervous. And to some extent, I feel that you were using the word our, we. So I would suggest that you use the word I. The center of discussion should be I. And I would also suggest that try to add more value to your essay because you have now given the freedom. There's no any word count. So don't repeat the essay which is already known to them. So try to add the value, how the things happened, how you started the journey, and what were the challenges, how you overcome the challenges, like this. And also keep in mind your response should not be too long. Like Saira is saying that for one question which are quite straightforward, and you are supposed to respond directly on that, but you are telling whole background. So
Mm.
it's always good that your response time should be like 3 to 4 minutes, so that they should ask the follow-up questions to dig out and to know that whether you are clear in your concepts or not, and whether you are particularly practically gone through that leadership and networking or not. They just want to check that. And another thing, like greet the interviewer with the questions, with the response like, "Thank you." You are just saying that thank you. So it's good that thank you for asking the great question. This is a question which is very close to my heart. Like this, you must appreciate the interviewer, that panel, that they have asked a wonderful question, an insightful question. And another thing, like, yeah, you were saying about your course, and you were saying that your whole discussion was on the climate and public health. So I would say suggest that don't use the words climate because there are too many courses offered by the UK university that are specific to the climate and meteorology. So you have selected only the public health. So don't do this, and also try to give the information which for which you are 100% accurate, like university ranking. I don't think that University of Manchester is on number one for the global public health. Again, you should search on that, the which University of UK is the University of the Year, and so always if you don't know anything, then you can just excuse, or you can say like, to the best of my knowledge, this university is the best, rather than just claiming the things which which might not be the right. Also, another response, like I was just curious to know why you selected the University of Manchester over the Imperial College London, but you were also telling us about the London School of Hygiene and Tropical Medicine, which was not the question. So always listen the question properly. If you don't understand, then you can ask for the repetition of that question rather than responding and giving the vague responses. So it's always there. And the last, like my question, last question will be if government is not supporting you, then what will you do? Then you were saying like I will discuss with my professors and I will get information that how to influence that because they assume that you are a leader and you are already influencing the people. So your response should be democratic, like how you will convince the people, how you will make the situation that will be win-win for you and for them, and how you will convince the government like this. And don't give like from this module I will learn and I will influence the government. So that's
I would
all
like,
the response from
sorry.
my side.
Are you done?
Yeah, I'm done.
All right, and the for the last question, I think what Razak is saying is right. I think your response was partially like it was half cooked. It wasn't wrong. It was half cooked. It needed some more stance that your action actually. So you provided the reason for that, but you didn't provide like your action around that. So it was half cooked. It wasn't wrong, but half cooked. Another thing I would say, um the Oxford question, I think. Uh, Abdurazak asked that why didn't you choose Oxford? Because you know kept mentioning that there is this group that you want to join and you're influenced by that and it will help. And I think you skipped answering that. So uh you can be asked like such questions and you should know if you don't know the reason you should know how to make a response to that question there and then because we don't know these are the questions that we are asking based on our experience or maybe the knowledge but we can't assure that obviously these questions would be asked there so you should know that how to respond to the question that is out of the syllabus.